very anxious to be very supportive of a plan that could save Kearney Hospital, along with its jobs and the retirement benefits that its employees deserve. Kearney Hospital was the first hospital in the city of Boston to give full admitting privileges to community health center doctors, long before any of the in-town teaching hospitals saw right to do that. Harbor Health Services has been admitting patients to Kearney Hospital for over 40 years. I personally have spent 33 years working here in Dorchester to organize healthcare services for those parts of the population that the private market either did not want to serve or could not serve. So I'm very anxious to be supportive of this. We were also very active in the last campaign when Kearney Hospital's future was threatened, and we were successful in that campaign when the new sheriff, Sheriff De La Torre, came into town and said the hospital will stay open. But I need to take a little bit of a different tack than all the other speakers before you this evening. We are faced with something that has never been done before in Massachusetts. Never before has a private equity firm come in and purchased an entire safety net hospital network. These are uncharted waters. It calls for more than the usual level of due diligence. An approach that asks for legitimate questions to be answered and conditions to be imposed is what's called for here. Those of us in the community health center world feel an intense pressure to understand what this deal will mean for us and for our patients. We have several concerns. First, Cerberus is a venture capital firm. They have a fiduciary responsibility to produce a rate of return for the people who invest their money with them. Sometimes it's wealthy individuals, sometimes it's pension funds, but they hold that money in trust, and they are required to produce a rate of return on that money. Caritas has not made money in many years. Now clearly, a business plan has been done that shows how we get from not making any money to making a reasonable rate of return. I think the question is, what's going to change? What are the steps? What will be done to take a hospital network that we've been told is about to close and make it attractive to private investors? That's not an antagonistic question, and it is not an unreasonable question. We want to know, are unprofitable lines of business going to be closed? Is investment going to be made in the more revenue-producing aspects of technology instead of in primary care? Those questions have been answered in the business plan. We were just asking for some discussion of that. Second, Caritas has been very clear and upfront in describing its intention to get ready for national health care reform. They want to be a successful network, and they need to be a large network. The devil's in the details. The way some systems do well in managed care is to have very closed systems where the hospitals you use and the specialists you use are severely restricted. There's nothing necessarily wrong with that. However, let's look for a moment at the patients that Community Health Center, Harbor Health Services patients serve. 25% of our patients label themselves as best served in another language. They're expensive patients to care for. Despite Massachusetts health care reform, 23% of the patients that walk through our door are uninsured. That means we have to take the time to screen them and try to get them enrolled in some of the public options. Some of the options that we enroll them in do not pay very well. How attractive are those patients going to be given the distance that the network has to go from where it is to what it needs to be to make a decent rate of return? 80% of our patients are below twice poverty. Every credible study in the country will tell you poorer patients are sicker patients. They're more expensive to care for. They're not always the best patients that you want in a managed care plan. Third, there's too much uncertainty. There are too many opportunities for unforeseen consequences. Now please understand, I'm not talking about evil intentions. I'm not talking about money-grubbing capitalists. I'm talking about unforeseen consequences of something that has never been done before. One condition that we would ask be placed is that Cerberus commit to work with the community health centers that do admit to Kearney Hospital. Our fear fear is that once the nature of our patients becomes clear, and the cost of caring for those patients becomes clear, that the conditions imposed on us to participate in the network might be too much for us. It would frankly make good business sense for Cerberus to develop competing primary care practices that they totally control and for whom they can more adequately and confidently predict what the cost of services should be. We would ask the Attorney General to open discussions on conditions that would be sure that community health centers in Dorchester, including the oldest community health center in the country, which does admit to Kearney, for 45 years, is not unintentionally hurt in our rush to save Caritas. We would ask that a mitigation and investment fund be established. Mitigation to help pay for any of the unforeseen consequences of this sale. An investment fund to make us stronger so that we can admit more patients to Kearney. I do not make this statement from a position of unconcern. There are about 70 medical surgical beds in Kearney Hospital right now, and every day of the week, 4 or 5 of them are filled by patients from Harbor Health Services. We do have a stake in Kearney. Finally, my father was an airplane mechanic in World War II. When planes were unfit to fly, it was the mechanic's job to make it right. Fix them up, make them ready to fly. So I said to my father, gee, Dad, the pilots really must have trusted you. He said, yes, they trusted me. But the rule was, the mechanic who fixed the plane goes in the first ride with the pilot. Caritas needs to be fixed. Cerberus says it has a way to fix it, but it's never been done before in Massachusetts. We need Cerberus to stay in the cockpit for more than 3 years with us. Let's make sure that this fix really does work. Let's have them stay for 6 years. Let's be sure that at the end of 3 years there isn't unintended consequences which weaken the system. So in summary, this is a wonderful opportunity for Caritas. But we only have one chance to make this right. You wouldn't buy a car without a warranty. You wouldn't take a drug that hadn't been tested. Why? Because it cuts down the possibility that something unforeseen would happen. The Department of Public Health and the Attorney General have the opportunity to give us a bit of a warranty, those of us in the community who have been laboring in the vineyards for many, many years. Mitigation, investment, a longer stay of time, reasonable rules for participation in the new network, and these would go a long way towards ensuring that community health centers in the Boston home in Dorchester will survive. Thank you.
Thank you very much.